I hit rock bottom. I wrapped my truck around a concrete telephone pole.
I knew it was a problem, man, when I was married. Me and my wife, we went through ups and downs, mostly downs, and I thought like, well, I'm drinking, so I'm okay. But I didn't see it affecting people like, you know, like my family, my wife and stuff. It was okay with me, so they could deal with it. But
Bad drinking started about 5 years ago, 6 years ago. Wife had cancer and was going through some rough times, so I was drinking a little more. And then when she passed away a year later, I delved deeply in whiskey and beer, and most of these bartenders in town knew my name. You got the liquor store calling by Andy when I come in the door, so. And I hit rock bottom. I wrapped my truck around a concrete telephone pole. And I realized at that moment I need some help. So right after I got out of jail, I come down here and signed up for COSAC.
I got well, my mom passed, and she left me her car, so I got drunk in the car, and I went riding and ended up somewhere I didn't even know where I was, really. So I said, well, maybe I need some help. And I seeked out the VA. I went to COSAC. Okay. Went through COSAC program, and you got to, meet the people in charge, and they started talking to me, and I said, well, this is what I need. So,
well, COSAC's a program to help people with their DOC, the drug of choice, yeah. And I had heard about it word of mouth, and I come down here, and they welcomed me in with open arms. I mean, and they were wonderful people, the instructors and other veterans. We all pulled together and helped each other. So it was really meaningful for me. I cried and broke down and cried sometimes, and they'd all come around me and hold me, and stuff like that really means a lot. And then they put some medications that really help the cravings go away.
First, we have a conversation about how they see alcohol impacting their lives and what the positives are that they see out of it and what the negatives are and what they see as their goals for the future. I tell all of my veterans who are struggling with anxiety and depression that alcohol has been shown to make the therapies that we have not as effective.
They asked me if I needed medication to help with cravings, and they wanted to know if I wanted a pill or a shot, and I told them I wanted a pill, and it was a lot of help, and they put me on some medication to help my cravings. And first week I didn't notice anything, but after that it really did curb my cravings. And I think everybody needs to get on it for a little while when they're in this program. It might help with all their DOCs, maybe. It helps with alcohol extremely well.
Okay, during the classes, some people started talking about the Vivitrol shots and how it affected them and stuff like that. I said, well, maybe I'll give that a try. I came to get help. And when they offered the shot, I was like, if it's going to help, I'm going to take it. I'm glad I did.
If they feel like, I just don't feel like I can do it on my own, or is there anything that can help, that's when I definitely dive in and I start talking about medications. If I feel like, they need them no matter what, I will bring it up. And I will always say, hey, we have something that can help you. And you don't have to stay on it long term. Maybe you only need to be on it for 6 months, maybe a year. And then you could just have it to use as needed for those stressful situations where you may need it, to overcome that family party where everybody's drinking around you. But we have a tool that can assist you.
I had no cravings, really. I go grab my friends, and the guys I hang with, they like, come on, man, take a shot with me, So, but I didn't want to even, participate in it, It was like, the feeling to drink wasn't there anymore. So after a while, it just goes away.
Before medication, I get up in the morning, I'd want to drink, and I'd take one. Especially, I thought it was helping my back pain. I broke my back in the service center. And alcohol got to be my DLC for back pain. I'd take my medication for back pain, then take a sweet whiskey with it. And then over the last 5 years, it got worse and worse where I was drinking all the time. I'd go to a bar here in town and I tried to drink it dry. And I'm seriously trying to drink it dry. I drank, one night, St. Patrick's night, I drank 26 double shots of whiskey. And I just wanted more and more. And that was rock bottom for me there. I had to find some help to get out of that mess. But since I've been on this medication and stuff, I hadn't even been in a bar. Just got no desire to go in there. No craving. So I think it would help a lot of people to try this medication.
When you address alcohol use disorder, don't address it accusatory. Really recognize that this is something that the individual is either using to cope, right? Or it is socially acceptable in their circle, because we often hang out with people who are just like us. So it's hard for individuals to realize that it's not normal to drink a bottle of wine every single night. It's not normal to go to the liquor store every other day to buy a big thing of vodka, because that's what all your buddies and that's what all your friends do. And when we think about our veteran population, it's also very normalized in the service, right? So you have to realize that it's part of their normalization, and then you have to help the individual realize this. And as a provider, you have to utilize things like medications and brief interventions to help veterans get better.
Right now, my life is much better as looking back to where I was, man, and not caring really about trying to better myself. The drug itself, it doesn't hurt, but if you give it a chance, it'll help you. So I'd say this. Without seeking help, man, you're headed down a slippery slope. Trouble, money-wise, family, even relationships. Right now I'm in between, but it's looking better. And just give it a try. Help yourself, help your family and kids and everything. Give them a chance to see the real you. It'll make a difference.
Yeah, it's doing wonderful. I mean, I hadn't had a drink since St. Patrick's Day last year, so. You need help, come up here and ask for help. They give it to you. I mean, it's no charge to it. The people are very understanding. They've been through it. The young veterans, you don't need to hit rock bottom. Come on out here now and take care of it before you do hit rock bottom. You drug of choice, cocaine or marijuana or fentanyl, whatever you're taking, get out here and get some help. These people are really understanding. They don't embarrass you and they don't put you up in front of people and talk down to you. These people are very understanding, and they got the medications to help you. So, and the counseling, it really does work. Center yourself, enjoy your family and stuff that you need to be enjoying instead of the liquor. You know, I highly recommend it. I enjoy my family very much. And now that Papa ain't drunk all the time, they're enjoying Papa.